When you close your eyes tonight and settle into bed, the position your body chooses might be silently setting the stage for one of the most devastating health events that can happen to an older adult. I'm talking about stroke. And what I'm about to share with you is something most cardiologists wish every person over 65 knew before they spend another night sleeping the wrong way. This isn't fear-mongering. This is medical reality that deserves your attention, because the position you've probably been sleeping in for decades could actually be increasing your overnight stroke risk significantly. Most of us never think about how we sleep. We find a comfortable position, we drift off, and we expect to wake up refreshed and ready for the day ahead. But here's what makes this so dangerous, and why a cardiologist would raise this concern. Your sleep position isn't just about comfort. It's directly connected to how blood flows through your neck, how your brain receives oxygen throughout those 8 hours, and how stable your cardiovascular system remains while you're completely unconscious and unable to notice warning signs. The position you've been sleeping in for possibly 40 or 50 years might actually be working against your body's ability to protect itself from one of the leading causes of disability in older adults. Let me be absolutely clear right from the start. A cardiologist wouldn't spend time warning about this unless the connection between sleep position and stroke risk was real, significant, and preventable. And the reason this matters so much right now, especially if you're over 65, is that stroke becomes increasingly common as we age. After 65, stroke moves into the top 5 causes of sudden disability, loss of independence, cognitive decline, and death. Most people think strokes happen randomly, like lightning striking without warning. But the truth is far more nuanced and far more hopeful. Many strokes are actually preventable. Many are connected to daily habits that nobody thinks to question, and many happen during or immediately after sleep, when your body is at its most vulnerable and you're completely unaware of what's happening inside your arteries. Here is what most people, and honestly many doctors, miss. Your sleep position directly affects how your carotid arteries function throughout the night. These are the 2 major blood vessels running along both sides of your neck. They're absolutely critical because they carry oxygen-rich blood directly to your brain. When you sleep in certain positions, especially positions where your head is rotated sharply to one side or your neck is twisted, you can accidentally compress these vital vessels for hours at a time. You're essentially reducing blood flow. You're cutting off the steady stream of oxygen your brain depends on. You're creating an environment where blood clots can form more easily. And you're doing this every single night, night after night, without realizing it's happening. The worst sleep position for stroke risk is sleeping on your side with your head turned sharply to one side. When you rotate your head far to the left or far to the right, you're bending that carotid artery. You're essentially kinking a garden hose. The blood can't flow smoothly through that bent space. The blood flow slows down. The blood sits longer in that compressed area. And here's the dangerous part. Slower moving blood is thicker blood. Thicker blood is blood that's more prone to forming clots. A clot forming in your carotid artery is one of the most direct pathways to a stroke happening in your brain. If you sleep this way for 8 hours every single night, night after night, for months or years, you're multiplying your risk exponentially. You're not just slightly increasing it, you're creating a genuine, ongoing threat to your brain health. Now, another high-risk position that many older adults sleep in is flat on the back, with the head turned completely to one side. Your neck is twisted, which means that artery is twisted as well. This position is particularly dangerous because people who sleep this way often experience loud snoring or sleep apnea, which is a condition where you actually stop breathing briefly multiple times throughout the night. When you have sleep apnea, even if you don't know you have it, your oxygen levels drop repeatedly. Your brain is starved of oxygen multiple times every hour. Your heart rate becomes irregular. Your blood pressure spikes repeatedly. All of this puts enormous strain on your cardiovascular system. And when you combine this oxygen deprivation with the mechanical compression from having your neck twisted, you've created an absolutely perfect environment for a stroke to happen. You're multiplying your risk factors rather than just adding them. The reason this is so serious, specifically for older adults, is something most people don't fully understand. As you age, your arteries naturally become less flexible. The walls of your blood vessels stiffen and lose their elasticity. Your blood becomes more prone to clotting. Your circulation is already slightly compromised compared to when you were 30 or 40 years old. Your heart has to work harder to pump blood to your brain. So when you add mechanical compression from a bad sleep position on top of these naturally aging blood vessels, you're not just adding one problem, You're multiplying all of them together. You're making an already vulnerable system even more vulnerable. You're creating a situation where stroke risk doesn't just increase a little bit. It can increase substantially. Let me walk you through exactly what happens in your body when you compress your carotid artery repeatedly during sleep. First, the blood flow slows down. The blood cells can't move as freely through that narrow, bent space. They start moving sluggishly. Second, when blood moves slowly, the platelets that normally float freely and move easily start to stick together. They begin aggregating. They start forming a clot. The longer the blood sits in that compressed area, the more likely a clot becomes. Third, your brain is receiving less oxygen than it actually needs. Even though you're sleeping peacefully, you have no idea this is happening. There's no alarm going off, no pain signal, nothing. Fourth, if that clot eventually breaks free from where it formed, it travels up through your carotid artery toward your brain. When it gets to a smaller artery in your brain, it gets stuck. It lodges there, and in that moment, blood can't reach that part of your brain. You've had a stroke. You might wake up unable to move your arm. You can't form words. You've lost vision in one eye. Your life changes in an instant. But here's what makes this even more urgent to understand. Many people don't experience an obvious stroke all at once. They don't wake up and notice something catastrophic. Instead, they have small clots, mini-strokes, TIAs, which doctors call transient ischemic attacks. They might feel a little bit dizzy. Maybe they stumble slightly. Maybe their speech is a bit slurred for a moment. Maybe they forget a word. But then it passes. They feel fine. They assume it was nothing. They go back to sleep in the same position. Nobody realizes their blood flow was compromised all night. Nobody knows that damage is accumulating in their brain. Nobody understands that they're having small clots that are starting to affect their memory, their balance, their thinking. And then one night, the wrong clot forms at the wrong time in the wrong place, and that's when they have a major stroke. That's when everything changes. Prevention starts with understanding this risk right now, before any of that happens. You have the power to change your sleep position tonight. You have the power to keep your carotid arteries open and your brain well supplied with oxygen. You have the power to reduce your stroke risk substantially without medications, without doctor's appointments, without anything expensive or complicated. You just need to understand what position is actually safe. The position that cardiologists actually recommend for stroke prevention is sleeping on your back, with your head supported neutrally by a pillow. Your neck is straight. Your head is not rotated to the side. Your carotid arteries are not being compressed or kinked. The blood flows freely and smoothly through your neck. Your brain receives steady oxygen all night long. Your cardiovascular system operates at its most efficient level. Your heart doesn't have to work as hard. Your blood pressure remains more stable. This position is also safer for your heart rhythm, safer for your blood pressure regulation, and safer for your brain. It's also the position that reduces snoring significantly and improves sleep apnea in many people, which gives you a double benefit. When you sleep on your back properly, you're protecting yourself on multiple fronts. Now, I understand something important here. Sleeping on your back isn't comfortable for everyone. Some of you have spent your entire lives sleeping on your side. You've spent 40, 50, 60 years sleeping one way. Your bed has actually shaped itself around your side sleeping habits. Your muscles have decades of memory. The idea of changing positions can feel impossible. You might think, how could I possibly sleep on my back? Won't I feel too exposed? Won't I snore more? Won't I be able to fall asleep? These are legitimate concerns. But here's the important part. This is not a matter of comfort competing with health and comfort losing. Your comfort can be restored. Your sleep quality can be just as good or better on your back. Your sleep position can be adjusted gradually. Your brain and your heart can be protected. It's actually possible to do both. If you're a lifelong side sleeper and the idea of switching to back sleeping feels too difficult, there's a very practical middle ground. You can sleep on your side, but you absolutely must keep your head straight. Don't turn your head far to the left or far to the right. Don't twist your neck. Instead, use a proper pillow that keeps your head aligned with your spine. Your neck stays neutral. Your arteries stay open. You get the comfort of side sleeping with much of the safety of back sleeping. It's not the perfect position, but it's significantly better than sleeping with your head twisted sharply. It's a compromise that protects your health while respecting your comfort. There's also the possibility of sleeping in a reclined position, which is a hybrid between back sleeping and side sleeping. Many older adults find this position very comfortable, and it reduces the likelihood of extreme neck rotation. A reclining bed, or even propping yourself up with multiple pillows can work very well. The key is that your neck and spine are relatively neutral and your head is not rotated severely to either side. This position can also help with sleep apnea and acid reflux, so it might offer additional benefits beyond stroke prevention. What makes changing your sleep position challenging for most people isn't usually the position itself, it's the habit. You've done this the same way for decades. Your body has muscle memory, your brain has established neural pathways, your sleeping body expects to fall into that familiar position. When you try something new, it feels wrong at first, it feels unfamiliar, it feels uncomfortable. Your brain is screaming that you're not doing this right. But this is something really important to understand. Your body adapts. Your nervous system is plastic. It learns new patterns. It takes about 2 to 3 weeks of consistent effort to build a new habit. 2 to 3 weeks. That's not a long time at all. That's not a significant sacrifice. 2 or 3 weeks out of the next 20 or 30 years of your life is actually incredibly short. And if this change reduces your stroke risk substantially, which the evidence suggests it can, then 2 or 3 weeks of mild discomfort is actually a very small price to pay. Here is exactly what you need to do, starting tonight, to make this change successfully. First, notice your current sleep position with actual awareness. Don't just assume you know. Set your phone to record yourself sleeping for one night, or ask a partner to watch you briefly and describe exactly what position you're in. See exactly what you're doing with your neck and head. Most people have no idea. They think they're sleeping flat on their back, but when they see the video, they're actually twisted. They think they're sleeping on their side with their head straight, but they're actually rotated with their head turned sharply. Awareness is the absolute first step. You can't change what you don't notice. Second, invest in a pillow that actually supports your neck properly. If you want to sleep on your back, you need a pillow that's not too thick and not too thin. It should support the natural curve of your neck. The back of your head should rest on the pillow, and your neck should be supported so it's in a straight line with your spine. When you turn your head to look around the room, your ears should move, but your neck shouldn't kink or bend sharply. The pillow should fill the space between your neck and the mattress. This is not about luxury. This is about structure and support. Third, if you want to sleep on your side, get a contoured pillow or a special side sleeping pillow that keeps your head aligned. Your head should be at the same height as your spine. It shouldn't droop down or tilt up. Your neck stays straight. Your ear should be roughly aligned with your shoulder. Your spine should be neutral from your head all the way down through your lower back. Some side sleepers also benefit from putting a pillow between their knees to keep their spine aligned throughout their entire body, not just their neck. Fourth, practice the new position for just 15 minutes before sleep for the first few nights. Don't try to fall asleep in the new position immediately. Instead, lie in the new position and read a book, podcast, or an audiobook. Let your body adjust while you're still partially awake and in control. This makes the transition so much easier than trying to fall asleep in an unfamiliar position immediately. Your brain gets used to the sensation. Your muscles start to relax into it. You build confidence that you can actually do this. Fifth, be patient and compassionate with yourself through this process. Some nights you'll revert to your old position without even realizing it. You'll wake up and find you've rolled back into your familiar pattern. That's completely normal. Your muscles have decades of habit. You're not failing. You're not doing anything wrong. You're just in transition. Your nervous system is learning something new. Each night you spend in a safer position is a night your brain receives better oxygen and your stroke risk drops. Each night builds on the previous night. The more nights you spend in a safer position, the more this becomes automatic, and eventually it becomes your new normal. Now, I want to address something important, because your safety matters. If you have any neck pain, existing spine problems, degenerative disc disease, arthritis in your neck, or other conditions that make certain positions uncomfortable or painful, don't force yourself into a position that causes pain. Pain is your body telling you something. Instead, talk with your doctor or a physical therapist about what position is safest for you specifically. Every person's anatomy is a little bit different. Some people have spine conditions that make certain positions genuinely problematic. Don't just assume the general recommendations apply exactly to your situation. Your individual health and your individual anatomy deserve individual guidance. But do have this conversation with your healthcare provider. Bring this information with you. Ask them specifically whether adjusting your sleep position is appropriate and safe for you. Also, if you have sleep apnea, which is extremely common in older adults. Changing your sleep position alone might not be enough to fully address the problem. You may need other treatments like a CPAP machine or a dental device that opens your airway, but changing your sleep position is still part of the solution because it can improve oxygen flow and reduce the severity of sleep apnea. It works better in combination with other treatments. Work with your doctor on a complete plan that addresses all of your individual risk factors and sleep issues. Here is something else that's worth understanding. If you've been sleeping in a risky position for years or decades, the damage that's already been done isn't instantly reversed just by changing your position now. Changing your position doesn't erase the past. It doesn't undo years of compromised blood flow, but it does prevent future damage. It stops the problem from getting worse. It stops the progression, and it significantly reduces your stroke risk going forward from this moment on. You can't change what's already happened, but you absolutely can change what happens from tonight onward. That's genuinely powerful. That's genuine control. The other critical piece you need to understand is that sleep position is just one factor in your overall stroke risk. Your total stroke risk is also affected by your blood pressure, your cholesterol level, whether you have atrial fibrillation or other heart rhythm problems, whether you smoke, your diet, your activity level, how much stress you're under, and whether you're managing chronic conditions like diabetes well. All of these things matter, but sleep position is something you can control completely and immediately. It's not dependent on medication or prescription refills or doctor visits. You can make this change tonight without waiting for anything or anyone. That's what makes it so powerful. It's in your complete control. I want you to think about this for a moment and really let it sink in. You probably don't spend much time thinking about your sleep. You just do it automatically every night. It's so routine that you don't even pay attention to it. But you spend about 1/3 of your entire life sleeping. 8 hours a night, every single night, for decades. Think about that number. If your sleep position is compressing your carotid artery, if it's reducing your brain's oxygen supply, if it's creating conditions for clots to form, you're creating a dangerous situation for 1/3 of your life. That's thousands of hours every year where your brain is receiving compromised blood flow, thousands of hours where clots are more likely to form, thousands of hours where damage is accumulating. When you think about it that way, changing your sleep position isn't a small thing that doesn't matter. It's actually one of the single most important daily habits you can change for your long-term brain health. Many older adults tell me they never realized stroke could be prevented at this level of detail. They thought strokes were genetic, determined by family history, and completely random. But the truth is that most strokes are actually preventable. They happen because of modifiable factors. Factors you can control. Bad sleep position is one. Uncontrolled high blood pressure is another. Atrial fibrillation is another. Poor diet is another. Inactivity is another. Smoking is another. Chronic stress is another. None of these are inevitable. None of these are written in stone. You have far more control over your stroke risk than you probably realize. You have far more power to protect your brain and your independence than you might think. Let me ask you something important here, and I really want to hear from you. In the comments below, I want to know, has anyone ever told you about the connection between sleep position and stroke risk? Has your doctor mentioned this to you? Has anyone warned you about how you're sleeping and what it might mean for your health? Because honestly, most people have never heard this information from their healthcare providers. Most older adults have no idea that how they sleep matters this much for their cardiovascular health. If this is completely new information to you, if this is the first time anyone has explained this connection, I want to hear about that. And if you already knew this, or if you're skeptical about whether sleep position really matters this much, I'd like to hear your perspective too. Have you experienced changes in your health by adjusting your sleep position? Has your doctor told you something different? This conversation matters because we all want to stay healthy and independent for as long as possible. The underlying message I want you to take away from everything I've shared is this. Your health doesn't just depend on the big dramatic things. Your health depends on the small daily habits that nobody thinks about. How you sleep is one of those habits. For the next few weeks, I want you to be intentional and conscious about it. Notice your position. Adjust it gently and gradually. Give your body time to adapt to something new. And protect your brain while you sleep every single night. Because your independence, your clarity of mind, your ability to remember things, your ability to care for yourself, and your ability to live the life you want to live depends on your brain staying healthy. And that starts with protecting the blood flow to your brain every single night. I want to say something important here, because I genuinely care about your safety and your well-being. If you're currently taking blood thinners or anticoagulants, if you have a history of stroke or TIA, if you have significant heart disease, if you've been diagnosed with atrial fibrillation, or if you're managing any serious medical conditions, please don't make major changes to your sleep routine without talking to your doctor first. Your situation is individual and unique. Your medical history matters. Your specific conditions deserve individual guidance. But I do encourage you to bring this up with your doctor. Show them the information. Ask them specifically whether adjusting your sleep position is appropriate and safe for you. This conversation with your doctor is really important and shouldn't be skipped. As you think about all of this information, I want you to remember that you're not trying to be perfect. Perfection isn't the goal. You're trying to be better than you were before. You're trying to reduce your risk. You're trying to give your brain the best possible chance to stay healthy and strong and sharp for the years to come. That's worth 2 or 3 weeks of mild adjustment as you get used to a new sleep position. That's worth the initial discomfort. That's worth the effort. The fact that you watched this entire video and listened carefully to everything I said tells me something important about you. It tells me you care about your health. You want to understand what's happening in your body. You're willing to make changes if they matter. You're not in denial about aging. You're being proactive. Those qualities are exactly what's needed to prevent serious health problems and to maintain independence and quality of life as you age. Your attention right now, your willingness to learn, your openness to change, these are the things that actually add years to your life and quality and joy to those years. So tonight, before you go to bed, I want you to think about what you've learned. Think about your sleep position. Think about your carotid arteries carrying oxygen to your brain. Think about protecting the most important thing you have, which is your brain, and your ability to think and feel and live independently. Think about your family and the people who depend on you being healthy, and consider making one small adjustment to how you sleep. That's all it takes to start making a difference in your health. One small change, one different position. That's the beginning. If this video has been helpful to you, if you've learned something important, please let me know by giving it a thumbs up. If you want to continue learning about senior health, heart health, stroke prevention, how to protect your independence as you age, and how to live a longer, healthier, more vibrant life, please subscribe to this channel. I'm making new videos on these topics all the time because I genuinely believe that older adults deserve clear, honest, caring, evidence-based health information. You deserve to understand your body. You deserve to know what matters. You deserve to live the best version of your life. Thank you so much for being here and for caring about your